Hi, Ben. Thanks for sending your slides through again. Do you want to give us a quick run through of what you've seen this month?
Yes, lots going on this month. Some people have started lambing, so we're starting to see the things that we're going to see more of as the spring progresses. We keep talking about fluke because fluke is still around and people keep getting caught out by fluke. Listeria is very common. We're just starting to get through some of the issues if lambs at processing don't get processed properly. That's navels, that's colostrum, and that's the results of bad hygiene at castrating and tailing, and then starting to get some ewes that have turned out and are dying. And I'll give you 3 reasons why ewes die, and they all look the same until you've done a post-mortem, and it obviously depends what they've died on and what you need to do about it. And then that's sheep, and then some cattle. Generally speaking, up here, cattle are still inside, and generally speaking, there's a lot of bad silage being fed, and some cattle are falling off the end of the earth because of that. And then I think we ought to give some thought to what's going to happen when calves get turned out, which hopefully, if it stops raining, won't be too long. So, firstly, fluke is still out there. It perhaps hasn't been as much as you might have thought, considering how wet it's been, but there are still people who are still getting caught out and surprised by fluke, which is generally speaking now chronic. As you can see from these 2 pictures, you can see quite big adult flukes in the gallbladder and in the bile ducts. This was a bloke who turned some ewes out to some known wetland before Christmas. The plan was to fluke them and move them, but like a lot of plans, the plans went wrong. They fluked them, and some time passed, a couple of weeks before he did move them, during which time we can surmise they picked up more fluke, and then they were poor and poor and poor. They were poor at scanning, didn't think too much about it, and they were poor. A couple of them started to die, and they were full of chronic fluke now, chronic fluke. So these would have been positive for worm eggs by now, because we're in March now. So it's still worth checking that fluke is not going to catch you out, especially before lambing, by all the normal diagnostic tests, and treat them if they're positive, obviously. So it is still there. Russian roulette. You may be lucky, but you can't ride your luck too much. It obviously has been a very wet back end, lots of mud flying, lots of exposure to bare soil when it's all poached, which means that listeria has been very, very common. Listeria does a few things to sheep. One is it causes encephalitis, and the way it causes encephalitis, it gets in through gaps in the tooth, like this picture on the right here. It goes into the brain, causes them to walk around in circles, all that sort of thing, causes them not to be able to swallow. Because they can't swallow, the rumen contents become very dry, like those rumen contents on the right there, on the left there of that picture. And often they die of dehydration as much as the encephalitis. Prevention, as always, is better than cure. So you've just got to do your utmost best to try to minimize the contact with bare soil that these sheep are having, and that means feeding them out of troughs and not directly onto the ground. And it also means, if they're housed, by looking at the silage and trying to avoid the mouldy bits as much as you possibly can. That applies to straw that they're bedded on, and it applies to hay or silage that they're being fed. But it's very common, listeria. Often it responds quite poorly to treatment, normally with penicillin things. Obviously it can cause abortions as well, and sometimes it can cause septicemia, but it's most famous really probably for encephalitis, and they're walking around in circles. But that's possibly been the commonest cause of sheep going off their legs just at the moment. I would say listeria, that would be the top of the list. Then we have all the usual problems of lamb processing. By processing, I mean picking up, tagging, tailing, castrating, dipping navels, and ensuring that they have enough colostrum. Here is the picture that I show every year. I see cases of this where bacteria get into the navel, next up the liver, and here on the right hand side of this picture is a liver absolutely full of abscesses, and those abscesses have arrived at the liver via the navel. So, as I get bored of saying, dipping navels is much better than spraying navels, and you have to dip them and dip them and dip them until they're completely desiccated. And if they're not completely desiccated, then dip them again. And dipping is better than spraying. and they don't just die of diseases that they picked up in the first 24 hours. In the first 24 hours, they can live a few weeks, a few months, and then die on you later on. The other risk of processing is infection introduced at tailing and castrating and ear tagging, which goes into the system and ends up in the spine, like this bottom picture here with a spinal abscess in the thorax. And already starting to see some lambs like the one in this video here, where you find them outside, off the legs, off their back legs, or with wonky front legs. And the commonest reason for that would be a spinal abscess. And once you have a spinal abscess, they're very difficult to treat, and they're it's very slow recovery. And although they may recover, they may lose ground, and you'll just get sick of looking at them. So it's probably caused by bacteria that live on the skin and get introduced into the system by the rubber rings at tailing and at castrating. So yeah, tip the odds in your favour by keeping the tailing irons in some disinfectant and keeping the rings as clean as you can. And if you start to get cases of joint ill, it may be worth tagging the lambs later rather than earlier, rather than when they're wet and newborn, because the risk of introducing infection with a tag is probably higher when the lambs are newborn. Having said that, tagging lambs, as we'll say later on, is extremely useful for managing them later on. I never understand why more people don't do it, but you can help yourself by dipping navels and by keeping the tags and the elastic bands as clean as possible to avoid problems later like that are going to be difficult to solve. So that's lambs. Then ewes. If you're a ewe that's just been turned out and you want to die, you've got three options really. Your first option is you can get an intestinal torsion, which is what this is. This is an abdomen with a great purple guts that have just twisted round. And how this happens is you've got a great big uterus full of lambs. Suddenly you give birth to those lambs. There's a lot of room in your abdomen, and your gut, if you start eating and eating and eating, you can suddenly eat more than you used to be able to because you've got more room. You eat a lot of grass, which is a lot of starch. The starch goes into your guts, and your guts sort of expand into that space and then twist round. And then this is what you find at post-mortem, picture like this with purple guts, or the next one, again with purple guts. And that's option number one. Option number two you've got is you can die of grass staggers. If you're milking two lambs, you're losing a lot of magnesium in your milk, and you may not be able to replace that magnesium, and you need to replace it every day. As much as you lose in milk, you've got to eat, and there may not be enough in the grass, or there, as we were just discussing, there are people who haven't been able to get out to feed these lambs because the fields are too wet and they're making too much of a mess. Often feeding ewes cake outside can replace the magnesium that they need, or supply the magnesium that they need. And if you suddenly remove the cake, you'll remove the supply of magnesium, and you'll make grass staggers much more likely. So I would consider, if that's going to happen, giving ewes a magnesium bolus before turnout if they've got twins or triplets and they're going to be losing a lot of magnesium through the milk. And on a post-mortem, you don't see anything really apart from a rumen full of lush grass and nothing else, because the ewe dies of a heart attack because of not having enough magnesium. So that's option number two. And option number three, if you're a ewe and you want to die after turnout, is you can die of peritonitis after a ruptured uterus, which is what that is there. But they all look the same. It's all a dead ewe until you do a post-mortem and you differentiate. And obviously the treatment for each is very different, so it's well worth knowing. So that's your ewes dying post-mortem. That's what's starting to happen. And then the tups, if you're a tup, you've got three options. If you want to die, you can get tups are often forgotten about and turned out into a expansive field where the grass suddenly grows and you suddenly get a slug of starch and a twisted gut because tups are greedy. Alternatively, they may be fed some creep, which may be inappropriate creep, and it may have too much calcium phosphorus, magnesium or protein, and it may not have any urine acidifier, ammonium chloride, so you may end up with stones in your bladder, and then the stones cause the bladder to block, the penis to block, and the kidneys just fill up and fill up and fill up, as you can see in this picture here, and then eventually your bladder ruptures and you die. So if you're feeding creep to tups that you've forgotten about, make sure it has some ammonium chloride in it so you don't get bladder stones and they die. And also make sure it hasn't got too much copper in it. Just the other day had a bloke whose tups had come out of the field and were being fed dairy cake, and they were Texels, and it took about a month for them to kill one and another month to kill a couple more because of accumulation of copper and copper poisoning. So make sure not too much copper, and make sure that there's some ammonium chloride in the creep. That's for tups. And my last thought at the moment is that everybody now is thinking about little lambs going out, growing, looking nice, and going to be ready to kill in 12, 14 weeks time. Those are the good lambs. Those lambs can look after themselves. I think now is the time to be thinking about the tail end lambs that are only going to be weighing 20 kilos when they're 6 months old, and what are you going to do with those lambs? It's no good making a plan of what to do with those lambs in September when you end up with a load of those lambs. Now is the time to be planning what to do with those lambs. And I would suggest the most useful thing you can do is to put a tag in their ear now, either when they're born or at the first gather, the coxy or the nematodirus drench, so that you can tell early when those lambs are starting not to grow, and then hatch a plan for them. They might want worming, they might want weaning, they might want moving to somewhere else, they might want putting on a herbal lay, they might want housing, but there's something needs to be done with them the minute the growth rates start to drop, not when they start to drop to zero, because if they start to drop to zero, soon they're going to drop to minus something, and then they're going to lose the ground that you've made. So hatch a plan now of what's going to happen to those lambs that aren't performing as they should. And now is the time to put off some grazing, or even plant some pastures to put those lambs on when they start to fail, when they're on their lambs. Don't worry, the lambs that are going to get away at 12 kilos, already be 40 kilos, they'll look after themselves. It's the little lambs that need the help, I think. So that's sheep. The one thing I wanted to mention with cattle is that there are a lot of cows inside at the moment, pregnant cows, eating crap silage that was cut late and is very stemmy and has low rumen degradable protein in it. And I know I mentioned it this last time, but it's still happening. And pregnant cows cannot manage on crap silage that was cut late and has too little protein in it. So if you think the protein might be worse, the silage rather might be worse than you think, get it analysed and make sure these cows have enough protein in it, because every day that passes, the calves are getting bigger inside and the protein demands are getting more and more and more. And protein will obviously also affect colostrum quality as well as colostrum quantity. So please, if you think the silage may be worse than you allow for it, than you're allowing, then please don't rely too much on crap silage, because it just does not get digested. And you can see here's a picture of a rumen with silage that has not been digested at all, and it's just completely bunged up. That's that. The other thing is, again, we're thinking about spring now, but we need to think, what are my demands going to be at the opposite end of the year? When it comes to next December, January, February, what is the cheapest way of me getting hold of some protein, some rumen degradable protein? Can I grow some? Can I put some clover into my sward? Can I grow a field of field beans? How is the best, cheapest way of getting some ERDP into those cows for this time next year, or for this time a month ago next year? And now is the time to plan what is your field use to provide some of that cheap protein for next year. And then I'll leave you with a thought that having your suckler calves in now is a bit like having a lion on a table. You want to do everything you possibly can to that lion while he's knocked out, because once you wake him up, you've got no chance of doing anything with him. And it's the same thing with once the suckler cows are turned out with their calves, it's a real pain in the arse to get them back in again. So while that lion's on the table, you want to brush his teeth, you want to clip his nails, you want to clean his eyebrows, you want to wipe his bum, all that sort of thing, while you've got the chance of doing it. It's the same with your suckler calves. If these calves need trace element supplementation, do it now, before, so that they're pre-charged before they go out. If they need BVD testing, do it now before you turn them out. If they need worming for lungworm, if they're replacements or something, do it now before you turn them out. Now is the chance to think, what are those calves going to need? Because the next time I see them, they're going to be 6, 7, 8 months old, and a lot might be different by then, and they might rely later on when they're housed at something that you could have given them now, like some trace element supplementation or something like that, so that their immunity is as good as it can be, and so that they grow as fast as they can do. So there's something to think about before turnout, so that they're turnout ready, if turnout ever happens, if it ever stops raining. Otherwise,
that's a great analogy to think about, Ben. Yeah, do everything while the lion's asleep.
Yes, exactly.
Yeah.
Otherwise, they'll end up on my post-mortem room table. So that's what's been going on in March, and we will reconvene in a month to see what's been going on in April.
Thank you very much, Ben. That's fantastic as always.